and welcome to On Call After Hours, where we answer the questions we didn't get to during our regular show. All of your questions are important to us, and we want to answer as many as we can for you. So here we go. Real quick answers. Please discuss omega-7, omega-3 benefits. Do you think they're of great value, or what do you think?
Those are great things to include in your diet, but if you just eat healthy from the farmer's market and take the Hibbard t-shirt test. So you get done brushing your teeth, lift up your t-shirt. If you like what you see under there, you don't have to worry too much about omega-3s.
Okay. And I think you're right. I don't think the omega-3, I mean, a Mediterranean diet, eat less. I'm not doing fish oil. I like ground flaxseed because it has omega-3 in it. Doctor, and it helps their bowels. You know what I mean? Do doctors recommend people do the heart screening programs, Riyad?
Oh, indeed. Indeed, we do. I mean, first of all, it's a cheap test, and it is very valuable. It gives you a good idea about, in general, what's your risk for coronary artery disease. They also, I believe, they do EKG, they do cholesterol level measurements. In addition, I think they added the ultrasound for the aorta and the carotid. So it is a very good kind of a screening test, cheap.
Okay. Here's Alcester. What is the best exercise for someone after 60?
Low impact exercise. You want to do those things that are easy on your joints, because exercise is a program for the rest of your life. A body that stays in motion, but jogging, even sometimes walking if you have problems with arthritis is hard on there, especially if you're overweight.
Discuss the factors taken into consideration to decide on a stent or other procedures. When do you know when to do a stent versus a bypass?
Usually we can get away with a stent if you have fewer vessels diseased. If you have 3 vessels or 2 vessels or a valve and some vessels diseased, then that pushes you over into the surgery category. But in general terms, we are doing many more things non-invasively through a small hole. You used to have your gallbladder out, big scar, a week in the hospital. Now you go home the same day. Same thing with the stents. Used to be the bypasses. Now you can go home the same day with a stent. Same thing with EP. He was talking about open surgery. Now they can use these catheters to go in and do the ablation, go home sooner, less invasive. In general, less invasive is better.
Okay. Borderline intraventricular conduction delay, what is that, and can I still exercise?
Well, it depends what it is. If it is borderline, I think what he's meaning by this is the electricity going through the heart through a special wiring system. And sometimes it goes a little bit slower through some of those. So we call it intraventricular conduction delay. By itself should not be a problem unless he has symptoms or issues like dizziness or passing out, issues like these. So then we would exercise them in general and see how good that conduction system is.
All right. What, do you predict with this kind of a thing, or like a right bundle branch block, that there's going to be conduction system problems in the future, pacemaker needs?
It depends on which side that he has a slowing with, but
right.
And whether or not he's on medications or if he has any underlying heart disease.
Okay. Here is if pig valves valve is used, is there a problem with rejection?
No, the valves have been treated so that the body doesn't reject them.
It's not a pig valve anymore. It's been
It's been treated chemically to make the proteins of the pig's valve inert so the body doesn't recognize them as foreign.
What is a normal pulse? Regular, active, occasionally has heart fibrillations, takes toprol and altase. Is this the cause? Do the drugs cause the heart irregular beats?
The drugs don't cause the irregular heartbeat. I mean, if he does have underlying atrial fibrillation, yes, we treat that with medications like beta blockers to control the heart rate better.
Okay. Told low blood calcium level, how is this related to the heart? What can be done? Told not to take calcium.
The calcium, you need calcium in your body for your bones to operate your muscles. The reason that the calcium deposits in the arteries, which is a lot of concern, is not because there's not supposed to be calcium in the body or that the levels are out of kilter. It's because there's an injury going on to the blood vessels themselves, and the calcium is being deposited there as a secondary phenomenon.
Dr. Rick, an esteemed guest, please elaborate on left bundle branch block.
Again, this is an issue with the electrical system of the heart. The electricity in the heart goes in a way that it goes distributed to both the right ventricle and the left ventricle. So the wire that goes into the left ventricle is called left bundle. And bundle branch block can happen for a variety of reasons. And we pick it up on the electrocardiogram, and that's just a definition of what that could not be. That's not a blockage of the artery. This is just electrical. It could be slowing, or it could be indeed a true block.
Okay. Heart failure. What are the symptoms? Quickly, what do you do?
Heart failure is the body's inappropriate or inability to manage its fluids from the heart. So usually it's fluid retention and shortness of breath are the sine qua non of heart failure.
Okay. And you treat it with?
You treat it usually with fluid medicine. Now, many people complain about, I have to take all these fluid pills, so I can't go to church, I can't go to my golf game, I can't do this, I can't do that, because I'm running to the bathroom all the time. Your body's like a bank account with fluid. You're always putting some in over here, you're always peeing and sweating and breathing over here. Those two things have to be in balance. If you don't put much in, then you don't have to get much out.
Yep. Had a mini stroke today, scared. What can be done to prevent future mini strokes? Am I at risk for more? And what lifestyle changes?
The stroke risk is from blood pressure and all the risks for heart disease. Blood pressure, cholesterol, obesity, exercise, a lack of, and cholesterol. And if you get all of those things under control, you can minimize your risk of having that. And then the medicines to try and make those things normal.
Sinus syndrome, sick sinus syndrome, flecainide, leaking of the heart, severe arthritis, aspirin, macular degeneration. Could the flecainide be giving a lot of side effects?
Well, it does have some side effects, but most patients tolerate it fine. There are obviously a few issues to look at when you prescribe that medication. So you will have to know more details about that.
All right. Two more questions. One, Rapid City, thyroid disease, too high of medication, went to atrial fib. We're going to restart. Went back into regular rhythm, but the heart goes into atrial fib again. What about atrial fib and thyroid?
Indeed, hyperthyroidism or increased activity of the thyroid gland can be a cause or trigger for atrial fibrillation, and the treatment in this situation is to really manage the thyroid issue itself. But still, the atrial fibrillation might persist beyond that, so that might need to be treated separately too. But you treat both the hyperthyroid state. Beta blockers have been notorious to be helpful with this, in addition to the management of the thyroid abnormality too.
I've had hypothyroid patients turn into atrial fib too.
Indeed, yeah.
So a thyroid should be just right.
That's
not
right.
too high, not too low.
Yeah.
Take-home message?
Live a healthy lifestyle.
Exercise, eat healthy food, and I'm sure you'll be able to take care of most of your problems.
Thank you both for helping us, and thank you for joining us on our website. We appreciate all of your questions and the opportunity to answer them. Be sure to join us next week on South Dakota Public Television at 7 p.m. Central, 6 p.m. Mountain, and call in or email your questions. And until next time, stay healthy out there, people.